Hi. Good afternoon, everyone. So today I'm going to talk to you a little bit about forensic anthropology is my area of specialty. And one of the things that we do is to work on cases. So actually, if you looked at your little cards, we would fit under the first strategic plan. I guess point would be creating safe, secure, and intelligent systems. So what we do is actually we work with the law enforcement in the state of North Carolina, and we also work with the NC Office of the Chief Medical Examiner working on forensic cases around the state. So when you have, we are hard tissue experts. So anytime that you have any kind of trauma or anything else that's going on bone, those cases actually get sent to us for consultation. But one thing I also wanted to bring up is that one of the things that drives forensics in general and forensic science in general is the federal court ruling of Daubert versus Morale Pharmaceuticals that was in 1993. And this court ruling talks about the admissibility of scientific evidence in the court systems. And it also refers to what it means to be an expert witness. So some of the things that they actually list out that you need to have peer-reviewed publications, that your methods are peer-reviewed, that your methods are validated, that you have error rates with your methods that you are using in court cases. And also, if these methods that you are using, are they accepted by the discipline or the community that you're dealing with? One of the things that came out in, as you can see in the journal Science, is forensic science an oxymoron? This actually set about a complete congressional investigation as to the forensic sciences, especially evidence, for example, the ones that are in law enforcement offices and the FBI, whether it's fingerprint analysts. Another thing that and what happened with that is that they were seeing that there was no direct relationship between universities and research and some of these people or practitioners that were actually conducting this kind of work. And one thing that they also realized is one of the ones that were very hard hit at the very beginning was fingerprints. The issue was, it's not that fingerprints are unreliable. The problem is that it had never been validated or its reliability had never been tested. So you had examiners that were identifying people, and there was no consensus as to how many points of concordance actually amounts to an identification. And we're dealing with identification of a perpetrator, setting someone in at the, establishing whether this perp was at the crime scene, and so it went into all these sorts of things. So then we had this congressional hearing decided that the National Academy of Sciences, and they conducted this report in 2009, and their report really hit hard on most of the forensic sciences. Luckily, in my discipline, we've been doing error checks for many, many decades now, and one of the things that we do establish is error rates and probabilities. We use Bayes' theorem to assess, probabilistic models for the work that we do. And one of the things now I wanted to point out too is that not everyone is a Daubert state, right? This is a federal court ruling. North Carolina became a Daubert state in January 2014, so we recently became Daubert, which was an amendment to the ruling of NC 702. And that would mean it's kind of like the Fry system that a lot of other states are still under, and that means at that point, the judge is still deciding who the expert is, and they come in to testify in court. But under the Fry, it's a little bit loosey-goosey, so you can say, well, because I have 20 years experience, that makes me an expert, not because I'm using, the appropriate methodology when assessing a case. The judge is still the gatekeeper, so the judge still decides and gets to determine what good science is and what bad science is. But recently, in I think the last couple of years, the FBI also had examiners looking at hair and hair identification of perpetrators. And the Innocence Project and the National Association of Criminal Defense Attorneys did a 3-year review, and they found that 26 out of 28 examiners at the FBI overstepped their interpretations of hair identification. And a lot of people ended up actually here. We had 32 defendants that were sentenced to death, and 14 had already been executed by the time that this report came out. So that's one of the things that we have to really be careful as practitioners, is to not overstep your bounds, especially North Carolina has one of the highest death penalty states in the country still, and that's something that we always have to keep in mind, that not to overstep or overwork for the prosecution. And a lot of things that happen when you have law enforcement working directly with prosecutors and they're doing the science and they're doing the research, it's very biased, right? And one thing that you have to remove that bias, because essentially they're making the data fit for what the prosecution wants to prove in the court. Another thing that I feel very strongly about, actually, is we have a professional responsibility to keep junk science out of the court systems. I hardly ever work for the defense, but I will get involved when I see junk science happening, because that is one of the things that we have to be is very responsible about, not allowing these sort of things to even get through the gatekeeper, right? Because judges and lawyers are not scientists. So you have to show them what the right science is and what's the wrong science. Like I said, many states are not a Daubert state. I actually worked recently in Virginia, the Commonwealth of Virginia, and they're still FRI, which is shocking to me. But that was very interesting, and they allowed a case that I actually worked for the defense on, a couple that their baby had died, but they were seeking the death penalty. However, they allowed somebody that had no credentialing in forensics to come in and testify in this court case. And so one thing that I always think you have to keep your moral compass on is, like, you're really going to send someone to death row because it's for kicks, right? So this is a case from North Carolina, out in Forsyth County. Ms. Rodriguez, I actually took all the gory pictures off of here, so don't worry, they're all gone. Ms. Rodriguez was found in, I think it was November. She was reported missing. Her body was found on December 1st. They had contacted Dr. Vass out of he's at Oak Ridge National Laboratories in Tennessee, because he does like the odor of decay. And he set up a postmortem interval. So this case had gone on for a few years, so we had to do a postmortem interval based on crime scene photographs. And one of the things that he had was he was basing the postmortem interval to fit within the time period, because Ms. Rodriguez had been found decapitated, naked in the woods. So they were trying to get her husband on death row for this time, and what they were trying to do is make sure that he was out of jail during that period of time, so they can actually, he would be found guilty for this crime. One of the things that he did is that his study is based on his dissertation work from 1992, based on 7 bodies. So we had a pretrial hearing, and one of the things that the judge, because we had this is 2014, become a Daubert state, he was asking him the right questions. Do you have error rates? What are the probabilities? I said, you have a sample of 7 individuals. How can you say that? How can you come up with an equation with just a small sample size? And the judge had asked him, it's like, okay, well, how do you know this? And he's like, well, I've seen hundreds and hundreds of dead bodies. Well, if you have, why didn't you change your study and add those to your study to come up with a better, robust equation? So she had been reported missing November 19th. She had been decapitated. Body was found December 12th. And what we look at is entomologists. We look at temperature, because one of the major drivers in decomposition are insect activity and also moisture in the soil moisture. So we found that the temperatures had dropped on December 2nd. She had fixed lividity. Fixed lividity happens within a few hours of the death of a body, and that's where you get that reddish. I had pictures, but they're too bad, so I didn't bring them. Where when you're laying on a certain, let's say if you're laying on the ground, the areas that the blood pools in the areas where you have been laying it. So you can assess the lividity and actually kind of get a semi-estimate of time since death. She had no bloating, so she was at very early stages of decomposition. There were no fungal reaction. There was no greenish discoloration in the abdomen, and that usually begins approximately about a week after death due to putrefaction, where you're decomposing from the inside out. There was also minimal scavenging activity, and remember she was decapitated, and also there was hardly any maggot activity. And based on the temperatures for that year, we got it from the weather station that was pretty close to the site where she was found. We should have seen a significant amount of maggot activity, especially at the site of trauma. So you always know there always come to the orifices and sites of trauma that you can assess. So Dr. Vass said that she had been out there for 16 to 20 days. Our assessment is 4 to 7 days, maximum 10 days, based on the weather data. So what happened here, and this is one time that I worked for the defense, he was actually barred from the North Carolina trial. They were going for the death penalty, and this actually came out in the newspaper, so I'm sure he was a little salty about that. But these are the sorts of things that, as having your moral compass, that we really should keep this kind of junk science. And he's the one that had worked on the Casey Anthony case in Florida, the little girl that went missing and died. And he testified on the odor of decay, and that he had smelled the decay that they had collected in some vial that they sent to him to get her. And that's why that case, she never got convicted, because they had a lot of this kind of junk science going on. Another thing that we do also, we don't only get rid of junk science from the courtrooms, but a lot of things too. We help our chief medical examiner on some of our hardest cases. Unfortunately, we have an expertise here in North Carolina on child fatalities. One of the other things that we do here is we assess fatal starvation, which is one of the hardest things to assess, even if you have an intact body, is to assess fatal starvation from skeletonized remains. And usually, these types of child abuse cases, especially fatal starvation, are from infants to about 14 months. It's usually the last child in the family. And they're based on low socioeconomic status. There's some mental health issues. It's usually the last child in the family that has this sort of thing. And when you actually go to the home, there are other indicators. Garbage, there's no infant or baby food really available, even things like dead rats on the countertops. So I mean, it's a really sense of decay that the family has. This young man, he was an airman. He pled guilty to killing his toddler son. His wife had left him. He would go to work. And unfortunately, a lot of the fatal starvation cases that we have are with our law enforcement, are with the military here in North Carolina. He would leave the 14-month-old with bread and water and leave for 8 to 10 hours a day. Then he met some lady online, decided to go away for the weekend and leave him behind, and when he came back, baby Theodore was dead. He then proceeded to dump him in a garbage bag and leave him on the side of the road. So one of the things that we're doing here in North Carolina that we are not using anywhere else really is using bone mineral density, because bone mineral density is directly associated with age. So it increases with age. There's a direct correlation with age and bone mineral density. And this is something that is used in developing countries to assess malnutrition because it's low radiation. So one thing that we were able to use and assess, yeah, there it is. You see here? Right, so this is a 95th percentile, and you would hope that he would be, at least in the 25th percentile range, right, to the 50th percentile range for bone mineral density. He's off the chart, right? And we know that boys and girls, it's a linear relationship. It increases with age up to about 10, and that's when boys and girls start differentiating with bone mineral density, and then we look at them differently. And then we also know we can use bone mineral density to age adults as well, because it really does go down after you hit 30, so your bone mineral density starts. It's a negative linear relationship with bone mineral density as you age as well. He was court-martialed. He was sentenced to life in prison, and he got dishonorable discharge as well. This is another thing that we've done here. This was a recent case, and I'll finish up quickly with this one. Son went into the crawl space to put up the cable. His mother had lived in the house and his sister had lived in the house. He freaks out. He finds a body bag with 2 dead babies in it. She's a drug addict, heroin addict. She says, I was doing drugs and they were stillbirths. So this is something that we can use. It's called the neonatal line. It's also, our lab here at NC State is one of the only ones in the United States that is using this. Those who are mothers out there, the process of birth is traumatic, not only for the child, but also for the mother, as we all know. But that trauma is actually scored on the teeth. So, and we can use the neonatal line as evidence of a live birth. So every mammal has this, dogs, cats, you name it. Every mammal has this neonatal line if it was a live birth, if it was a cesarean section, all of these things. So if it's a live birth, you have to live 3 to 4 days in order to be able to see that line though, right? So if the line is missing doesn't necessarily mean that there was no infanticide, but in a lot of these cases, we can. And so it's enamel related to growth. It's an accentuated stria of Retzius. We can look at it histologically, and this was discovered back in 1936. So a normal neonatal line is about 12 micrometers wider for operative or premature deaths. So what we're looking at here, this is a cross-section of a deciduous dentition. And so we're looking at the line, so you have prenatal enamel, and then you have postnatal enamel. And we're looking at this, it's this black line right here, and it's this line back here. So baby doe 1 was around 36 to 42 weeks when we aged him skeletally, right? It's around normal, right, to term. We couldn't get the ages closer to that. But the fact that he had a neonatal line was the fact that there was a live birth. So they also investigated this woman because obviously it was not a stillbirth. Baby number 2, also the neonatal line right here. This is a cross-section of a tooth, and there it's right there. We estimated this baby to be about 38 to 40 weeks. Also was alive. And just to say, this woman had been known to have been pregnant 11 times, but there are only 3 live children accounted for. All right, so this is something that she did quite a bit. And the ME ruled undetermined cause of death, but homicide, right? Because we don't really know what killed the children, but she obviously ruled it a homicide. Another thing that we have applied, our medical examiner sometimes think that we can make wine out of water, and you get 3 scrappy little pieces of bone, very weathered. North Carolina soil is not good for preservation. You will be completely obliterated within 30 years. It's the acidity of the soil, it's the clay soils that we have are not very good for preservation. So the story for this case is this young man, actually a young man goes out by Cary he went running. He finds a wallet, takes the wallet home because it had an ID in it. He looks up on the computer this name, and he realizes this person had been missing since 1992. So then we go back, and we are able, so I'm trying to see, obviously it was a young man, age of 20, but you can't assess any of that based on this. So the first thing we did is do a radiocarbon test, a post-bomb test. And the radiocarbon is like when they were doing the atomic testing back in the 1940s, the levels of that layer in the atmosphere actually get stored in your bones. So we can tell whether you're post-1950s or pre-1950s based on the levels of carbon-14 in your remains. So we found out, obviously, that he was modern. The next thing we had to do, based on the levels of carbon that are, where are they? It's like right up here, right here, in the bones, was to assess. We tried to figure out year of death, that you can assess year of death. And how did we do this? We used the lag time because he was 20, and the lag time for someone in their 20s is 11.9 years. So we add, this is the year that the beta analytic or the lab that sent it to us for carbon-14 said. So we add 11.9 and we got 19.93 estimated year of death. So we were able to say that the remains were consistent with this young man, and he was actually then identified via DNA. So that was him. And the story with him was he was 20, he had come to Raleigh for a Grateful Dead concert. He had dropped a little too much acid. His buddies left him, and then they went back to Florida and left him, and he disappeared, and they never found him. Let's see. We can also calculate year of birth using teeth. So for this case, we didn't know the remains had been burnt down in a house, and they had been abandoned for a few years. We needed to assess year of birth and also year of death. So here, what we do is use the same carbon in the teeth, and the reason why we use teeth, because the crowns of the tooth are set in early years, and they don't remodel, whereas the rest of the skeleton remodels about every 8 to 10 years, right? So that's why we use teeth here. And so for someone, so the second incisor that we used, it's 4.4 years, I think, so we were able to trace it back that his year of birth was 1976. And then we were also able to say with 91.1% probability that the year of death was between 1996, I think it says, to 2000. So we were able to get a timeline for this person, so hopefully at one point we will actually get an identification. So that's another part of the work that we do. That's one of our primary human rights, your right to personal identification. So that's one of the things that we work with all of the unidentified border crossers here in the US and also internationally, is to try to give people back their names. So we're going through every cold case in the state right now for all dating back to the 1960s that we can actually give a name to some of these people. Another thing that we have done here, and I don't know why North Carolina has such a high frequency of dismemberments, but we do. This is Ms. Smith, and as you can see, these are her femora, proximal femora, and what we did was we used a pig proxy to test the saw that was used, and when we look at it under the microscope, this is the victim, and here's the saw, and you can tell it's consistent, so that was a match. And he pled guilty, and he's serving life in prison. This is the saw that we tested. A lot of times, either they find it at the scene and they let us use it to test it, or sometimes they have found receipts that they go and buy the same saw for us, or sometimes we don't know what it is and we have to assess the type of weapon that was used. Any questions? Yes.
That was amazing. So this is a philosophical question. So how do you sleep at night? I mean, how do you decide to free yourself from this work?
Well, especially with, that's a really good question. With the kid cases, you don't sleep until the case is done. You always take it home, right? You mull over it. You think about what's another way that we can actually assess something, or did we miss something? So yeah, and the way I see it too is like we're their only voice, right? They have no one else, so you're their voice, and you have to speak up. Thank you. Yes.
So you present a lot of case studies using different technologies to assess what's going on. Where do you stand in actually developing the technologies, and how do you go about that?
Good question. Now, one thing that we just published, and we have a National Institute of Justice grant, is using bone mineral density to, one of the hardest things to do is aging adults, because after you hit 30, all of our aging parameters are based on degenerative changes of the joint surfaces, which is not an intrinsic factor. But we know bone mineral density, which is intrinsic, and that is something that we're actually using the NHANES data to do that in a large sample of over 14,000 individuals. So we're developing new equations. So one of the things that I do is develop new equations for, let's say, for stature or living stature from skeletal samples that we have. So we develop new standards for identification.
I guess I'm asking more about how do you reach outside of your area, your center, your activity? How do you find people to help develop new tools?
That is based on, I call it case-driven research. Every case is different. So anytime that we have a case that is complicated, that's when you start thinking outside of the box. And that's how we reach out to other people. Because we work with entomologists all the time on the post-mortem interval.
Well, there you go,
Yeah.
there's an example.
Yeah.
What about other groups?
One thing that we're trying to assess is pattern analysis. So we actually, with our cluster, we have a young man who does digital forensics. And hopefully he'll be able to help us with that. Yeah. Yes.
Can you say a couple words about, I mean, you've done a lot of analysis here. What about the analytical equipment or facilities you have versus the shared facilities at the university? Do you make use of a lot of the shared facilities at the university, or you have your own facilities?
I have my own microscope, my own bone mineral density scanner, and for carbon-14, we send it out to an ISO lab. So everything in forensics has to be like ISO this and ISO that. One of the things that we have issues with is chain of custody. So we have to know exactly where that piece of evidence is at all times. So that's one of the, if we can use shared facilities as long as I'm sitting there next to it for the entire process. But if it's something that takes days, so for example, the histology actually gets done in Dr. Schweitzer's lab because she has a closed access facility that we can actually make sure that the evidence or the chain of custody is not broken.
Let's give her a hand. Thank you.